All right, welcome everybody. My name's Bob Keel. I'm a physician assistant with the Memorial Hospital of Carbon County. I'd like to welcome you to our first installment of what we're going to call the Ortho-Minute. It's a monthly or twice a month opportunity for us to discuss topics in orthopedics that are frequently asked questions that we get here in the orthopedic clinic. I do practice here out of the physical location of the hospital, the Memorial Hospital of Carbon County. I do work with orthopedic surgeon, Dr. Corey Colstead. He is a surgeon that lives in Colorado, practices for a company called Rural Partners in Medicine, based out of Colorado, that do rural medicine for a bunch of different hospitals all around the country in rural settings. And we're lucky enough to get Dr. Colstead here on a weekly basis. He has 2 decades worth of orthopedic surgery experience underneath his belt, specializes in mainly sports medicine, bone and joint disorders. However, today the topic I'd like to discuss is what do we do here and what do we not do here. And so as far as Dr. Colstead, when Dr. Colstead comes, he sees patients in clinic and does surgeries in our operating room here. When he's not here, I manage his patients for him. I do all of the preoperative management, postoperative management, and I do the majority of the diagnosis of orthopedic conditions. And so you see a lot of me, and you do get to see Colstead usually before surgery or the day of surgery. A lot of what we do is, if you can imagine your body as a structure, it's the bones or the framing, the actual structure of the body. And so anything bone or joint related, we do that. So when I'm talking bone and joint, think of your shoulder, your elbow, your wrist, your hip, your knees, your ankle. Those are probably the vast majority of the cases we do. We do some stuff with hands and feet as well. However, hands and feet bone issues oftentimes get pretty complicated, and most of those will go to a specialist that is a specialist in either the foot or the hand. Those cases are very rare, and most of the time those are taken care of here at the clinic, the MHCC Orthopedic Clinic. A lot of the conditions we treat, osteoarthritis is probably the number one. Osteoarthritis is where you get just the normal wear and tear of the bone and joint. In the hip, the shoulder, the knee are probably the most common we see with osteoarthritis. Fractures, when you fall, you have an injury, something happens and you break something, and we take care of that. Most of the fractures we see happen to be in either the wrist or the ankle, but we take care of fractures anywhere in the body. So what do we not take care of here at the orthopedic clinic? And what we really don't do any sort of procedures for are anything that has to do with the spinal column. Those, we do have some providers we work really closely with, and we can get you in touch with them. If we don't have to do a procedure on it, if it's diagnosing a problem, if it's treating a problem, oftentimes we can take care of that here. And so what I usually tell people, do you take care of this or not? I say, come see me. Let us sit down, let us talk, and if it's something that Dr. Colstead does not manage, if it's something that we don't take care of, then we can get you to the place that you need to go to, where we have close connections, good relationships with these providers, and make that process a little bit easier for you. We do have various relationships with providers throughout this region, both north and south of us, west, and so we do feel confident in those connections that we have and the ability we have to transfer people when their care is a little more specialized than what we do here. As far as a lot of the procedures that we do, I'll get questions asked about, well, can Dr. Colstead do this here in Rollins, at this Rollins facility? And luckily, we have an administration that works with us very closely and helps us get the equipment and supplies that we need to where we can do anything that Dr. Colstead does surgery on, we can do here at the Memorial Hospital of Carbon County. We have close relationships with equipment manufacturers. For example, in the knee replacements we use a robot to help us in that surgery. And that robot is here and all of the equipment is brought in when we do knee replacements. When it is a shoulder rotator cuff repair, we have a company that works with us really closely out of Denver that will come in and bring the actual anchors and stuff needed, and we do everything right here out of this operating room. The follow-up care is all done here by myself and Dr. Colstead, and we are trying to make this into a one-stop shop. You can come here, you can see us, and we can get you the care that you need. And so today, as part of that first installment, that was our goal, is to introduce what we do and what we don't do here. So the short answer, the Cliff Note version is we can have you come in and we can have you see us, and if it's something that we don't do, we get you where you need to go. Mainly it's anything to do with the spinal column or the spine. Very rarely it can be a hand or a foot problem that we don't see. Everything else we take care of here, and we have the experience here to help keep you healthy and make you better.